Hi guys, it's me. Finally, after 2 years away from this channel, here I am again. If you've been here since my exam vlogs and late night study chaos, welcome back. If you're new, hi. I'm Rizal, a medical student, and I've just entered one of the most exciting and terrifying parts of med school, which is clinical training. Over the past 2 years, life happened, med school happened too, and I stopped posting. But something shifted recently. Now that I'm actually stepping into hospitals, meeting patients, watching real life medicine unfold. It's fun, overwhelming, yeah, but fun in a way that makes me want to bring you with me for the ride. So, to kick things off, I thought, what better way to start than by sharing what I wish I knew before starting clinical training? This is for every med student who is about to start and for anyone dreaming of being one someday. Hopefully, it saves you some awkward moments. And yeah, let's get started. The first thing to take away is you don't have to know everything, but you do need to observe everything. When I first walked into the hospital, I thought they expected me to remember every single thing from textbooks. But they didn't actually. What they did expect was to pay attention. The way a patient struggles to breathe, how a doctor breaks bad news, the steps a nurse takes before inserting an IV. These details stick with you in a way no lecture can. You learn medicine as much by watching and listening as by studying. Ask questions even if your voice shakes. I used to stay quiet because I didn't want to sound stupid. But here's the truth. People remember you for your curiosity, not for your silence. And most of the time, someone else in the room had the same question, but didn't ask and didn't dare. Every time I asked, I learned something I would never have found in a textbook. Curiosity is your superpower. In clinical training, you don't have knowledge yet, but you do have curiosity. That's your biggest strength. Use it. Ask why a drug is chosen, why a diagnosis makes sense, why a test is skipped. Curiosity turns every word round into a lecture, and you're the one guiding it. In the first weeks, I felt like a piece of hospital furniture, standing in the wrong place, unsure what to do. That's totally normal. There will be days you just follow the doctor around or measure vitals or maybe repeat the same thing. It might feel small, but you're building comfort in the hospital environment. And one day, without even realizing it, you'll be the one guiding others. One of the best habits I built early on was taking notes on my phone or snapping quick pictures of things I didn't want to forget. The hospital moves so fast. You hear a diagnosis, you see something new, or you maybe listen to someone and he's mentioning a drug name or names of different things. And if you don't capture it right away, it's gone. Later, when I reviewed my notes, those little screenshots and quick lines turned into my personal hospital textbook. It really made everything stick better. By the way, if you're wondering why the clips don't always match what I'm talking about, that's on purpose. I don't usually film inside hospitals because of patients' privacy, and that's something sacred. So instead, you're getting pieces of my real life, the coffee breaks, the notes, the city walks, and basically everything around med school that keeps me sane. Think of it as a behind the scenes for my journey, while I share what's happening on the inside. I used to think the right way was to learn the lecture, then see the case in the hospital. But I found it actually worked better the other way around. When I watched or observed something first, then went back to the lecture, suddenly everything made sense. It wasn't just abstract knowledge, it had a face, a story, a memory attached. Don't be afraid to flip the order of learning. Sometimes your brain remembers more when experience comes first. The first days in the hospital feel messy. You're trying to listen, to ask questions, to write things down, and suddenly the patient's story feels like pieces of a puzzle scattered everywhere. What helped me was making my own simple history taken sheets. Just a template with spaces for symptoms, onset, duration, treatments, and habits. It kept me from being lost and it gave me structure until asking those questions became second nature. The main thing is that don't compare yourself. In clinicals, it's easy to look at classmates who always seem confident, who ask questions faster, who get along with the doctors right away, and you start to feel behind. But here's what I learned: medicine isn't a race. Everyone grows at a different pace. The important thing is to keep showing up, learning a little more each day, and trusting that your time will come too. One of the hardest lessons for me was realizing that not knowing isn't failure, it's the beginning. Aren't about proving you're smart, they're about showing you're willing to learn. Every time I said, I don't know, but I want to understand, I got taught something I will never forget. So, that's what I wish I knew before starting my clinical rotations. This is just the beginning. I'll be sharing stories from my days in the hospital, tips for surviving med school, and the honest side of student doctor life. If you want to follow along, hit the subscribe button, leave a comment, and tell me what's one thing you're curious about when it comes to clinical training. Thank you so much for your attention. Take care of yourself and see you next time.